How can porcelain veneers improve a patient's smile?
Porcelain veneer is a covering. It's if the external surface of the tooth has been worn, chipped on its edges, or any part of the tooth is missing, or the tooth is slightly rotated but not enough to warrant orthodontic treatment, oftentimes that portion of the tooth that's missing needs to be resurfaced, if you will. Recovering it or resurfacing it is a good term. So, for example, it's like a false fingernail. Patients present oftentimes with false fingernails, and you look at them and you realize that either they had fingernails that were either very short and they wanted to lengthen them, they wanted to reshape them, they weren't shapely enough, and in the interim, it's a problem until the nail grows out or whatever. In this instance, you can't regrow tooth structure, but in a way, the covering that you place on the top can restore not just the aesthetics and the shaping of the tooth, but actually restore the tooth to full function again. These are made out of ceramic. They are bonded to the surface of the enamel of the tooth in a manner that makes them structurally strong, sometimes by layering this cover of porcelain on the surface of the enamel of the tooth can make the tooth even stronger again. So unlike the false fingernails that may be not very natural looking, certainly not very long lasting, ceramic veneers can last a very long time, and they are exceptionally aesthetic. So here's a very good example of a patient who benefited from ceramic veneers. As you can see, the edges of the patient's front teeth have been severely worn. In fact, when you take a look at the edges of the front teeth relative to the lower lip line, you can see how the contour of the edges of her front teeth create almost a reverse smile relative to that lower lip, and that tends to be fairly unaesthetic. So we're looking to accomplish two things here. Restore the teeth to their normal and natural shapes and forms, but also address any of the aesthetic considerations to enhance her smile. So here are the actual veneers after they've been bonded to the underlying enamel of the tooth structure. And you can see that we've enhanced the incisal edge relationship. The edges of the teeth are now in that convexity that we want. Take a look at the gum tissue around the neck of each of these veneers. Take a look at the vibrancy in the edges of the teeth as well, the translucencies. They look very normal and very natural.